More than 15 million children between the ages of 13 and 15 around the world are now vaping. That's not a typo. 15 million, and according to the World Health Organization, kids are 9 times more likely to vape than adults. This isn't just a trend anymore. It's an epidemic quietly spreading through schools, playgrounds, and social media feeds. The World Health Organization's new report paints a worrying picture. Globally, there are more than 100 million e-cigarette users. While most are adults, the rise in children picking up vaping devices is exploding. And it's not hard to see why. Sleek designs, fruity flavors, and clever marketing make these devices look harmless, even fun. But what's inside tells a different story: nicotine, chemicals, and addiction. The report warns that many e-cigarettes are being marketed directly to young people, often using influencers, bright packaging, and bubblegum or mango flavors that appeal to teenagers. These products are easily available online, sometimes even in places where sales are supposedly banned. The WHO says this growing industry is hooking a new generation on nicotine, and it's reversing decades of progress in fighting tobacco use. For context, some countries already report alarming figures. In certain regions, nearly 1 in 5 school-going teens have tried vaping. Many say they were attracted by the flavors, while others simply wanted to try what everyone else was doing. But experts warn, early exposure to nicotine can harm brain development and increase the risk of addiction later in life. Supporters of vaping often argue that it's a safer alternative for adult smokers trying to quit. But health experts caution that for young people who never smoked, vaping is not harm reduction, it's harm introduction. And it could even lead some teens to start smoking real cigarettes later on. The WHO is calling for urgent action, from stricter regulations and public education to bans on youth-targeted marketing. They say without global cooperation, millions more young lives could be affected. Here's the big question for all of us: how far should governments go to protect children from vaping, and where should the line be drawn between personal choice and public health? If you found this story important, don't forget to like, share, and subscribe to 2230, bringing you the news that matters, straight and real.